on Twitch in a few weeks. And so if you want to see this presentation in a later date, you're more than welcome to. We will be sending out the promo for that soon. Let's see, anything else? Anything else, ladies, I've left off?
Nope.
Nope. All right. Well, thank you so much and enjoy the presentation.
Okay, thank you so much, Paula. It's really wonderful to be here. I'm happy that the University of South Alabama and these great librarians have invited me to give my presentation today. So welcome to Healthcare, It Just Got Graphic. My name is Jamie Stanfield. And there we go, all right. And I am the Science, Nursing, and Health Librarian at the University of Southern Mississippi's Gulf Coast Library in Long Beach. My contact information is here for you. I'll also have it at the end of the presentation so that if you want to contact me to collaborate or ask more about graphic medicine or anything, you are more than welcome to do it. Please feel free to do so. So the first thing that we would like to discuss is what exactly is graphic medicine. The term was coined by Dr. Ian Williams, who is still an avid member of the graphic medicine community. And he said that it is the intersection of the medium of comics and the discourse of healthcare. And essentially, it's comics meets healthcare. And one thing that it is that you will not see in your normal medical books, textbooks, the types of teaching books that we tend to see in our schools is the personal experience. It's an outlet for telling a story, oftentimes a nonfiction, true story that is created by those that went through this experience. Sometimes it's the patients themselves, other times it's family members, and sometimes caregivers are moved to create a novel from what they experience, and that includes nurses and doctors. What you see here is often a very personal experience, and it gives people a way to connect that you might not find in your normal textbooks that we see about medicine. Today we're going to go over 4 books. We're going to look at 2 works of fiction and how they can contribute to telling a story that will connect with someone who may very well be going through a real life experience, and this can give them something that they can share. They won't feel as isolated, even though it's a fictional story. And we don't know if maybe the author knew someone that went through this and it's based on that, but it's still a great way to communicate to people that feel isolated or all alone. We're also going to look at 2 works of nonfiction, and one is Kid Gloves. I just recently got finished reading this and literally just added this to the program, but it spoke to me and I felt the need to do so. As well as RX, Prescription, a graphic memoir by Rachel Lindsay, and both of these are narratives from the person's perspective that went through this healthcare journey. And so you might wonder, well, why should we be reading graphic medicine? Why can't we get this from WebMD? What is this going to give us that, Google won't give us, or the textbooks? Well, as I was saying, it helps people to really empathize when they can look at the person's perspective that went through it. Oftentimes in the medical industry, we don't know exactly what the patient's going through. We think we do because we've been through college and we've learned all about this disease and this illness. But if we've not walked a mile in their shoes, we really don't know exactly what that patient is going through. And so graphic medicine helps not only healthcare workers, but students that are planning to be healthcare workers and those with a similar or the same type of illness to really understand the patient's or the caregiver's point of view that is writing the story. Like other graphic novels, narratives, works, memoirs, we can argue over the names later, it appeals to visual learners. It pulls in people that when they see text and page after page of text and prose, they might be a little shy, but they can take a 120 or 150 page work in a graphic novel and really learn from that because they're visual learners. On the same token, this will help draw in reluctant readers. For whatever reason, they don't connect, they don't feel like they learn much from the standard textbooks. However, they do feel like they can begin to learn from something in a graphic novel, which can then lead them on the path to having a greater health literacy. And then when they do see the medical texts and various works that students have to read, it may very well put them on a more confident level because they've already heard that. They've already read about this in a graphic novel. And so it also helps poorer readers just by the same reason it draws in reluctant readers. And so I would say to you that by reading graphic medicine in and of itself is going to increase health literacy. Now, when you think about health literacy, we all probably know what literacy is. But when you look at health literacy, the Institute of Medicine defines it very, very well. And there's a lot packed in this one sentence. The degree to which individuals have the capacity to obtain, process, and understand basic health information and services needed to make appropriate health decisions. That's a lot. So not only do you have to have the means to obtain, but you have to process the information given to you. And you have to understand it. Because if you don't understand it, then clearly you're not going to have the necessary skills to make appropriate health decisions. And we're going to talk a little bit about how sometimes even when we're in our doctor's office or in our nurse practitioner's office and they tell us things, we just stare at them like, I have no clue what you just said. Well, imagine if you didn't have access to much healthcare at all, or certainly healthcare information. And so because of this, as we begin to get data, the Institute of Medicine and the National Institute of Health note that it is very likely that 9 out of 10 adults lack a proficient health literacy to manage their health and illness. And when they begin to break down which groups are more vulnerable to this, then we see, for example, older adults, by way that as they get older, their cognitive abilities decrease. Perhaps they were of the generation that did not get to finish school. Perhaps they had to help their parents work, or they had to get a job. People with low incomes, I think just by their very nature of having a low income, they may not have access to obtaining information, certainly understanding information, and then also they may not be as well informed on making an appropriate health decision for themselves. So when you look at low income and then people without a high school diploma, you start to see a trend. So it's very specific groups that can be even more, they may have even lower health proficiency ratings, or proficient health literacy ratings. I'm trying to read my own writing and talk at the same time. And these can be huge factors in determining how health literacy rates are obtained. Another huge factor is English as a second language. So in the United States, for the most part, English is the predominant language used in healthcare. Now, that's not to say that in lots of hospitals hospitals and clinics, etc., that there's not interpreters. There are. However, that's not always the case. And so I have an example that has stuck with me for several years from an old show that I watched. And it was a particular episode. And it was a fictional show, but this particular example stuck with me. And it was about a couple, and a man had come in on the ambulance, and he was not breathing, and his heart rate was very, very low, and he really just wasn't doing well at all. And as his wife started handing the doctor his bottles of medicine and speaking Spanish to the doctor had a Spanish nurse come in, and she began to interpret what the lady was saying. And she handed him a bottle of a very powerful heart medication, and it said take once daily. And so once, ONCE in Spanish is once, and that is 11. And so her husband took 11 of those heart pills, and he was very toxic, and his heart was barely beating. And that just kind of stuck with me as an extreme example, but an example nonetheless. So for example, let's say that we do have someone in the hospital, and they go home with post-operative orders of what they're supposed to do. If they don't read English very well, they could run into some serious health problems. So these are things that we have to look at when we talk about health literacy rates. So when we talk about health literacy, we of course have to talk about medical terminology. And some people call it gobbledygook. The first time I ever heard the term gobbledygook was from my precious grandmother. And she would come home from the doctor, and she would tell my dad, as she was talking about what the doctor said, oh, you know, he just said a whole bunch of gobbledygook that I didn't understand. And so when I have this particular presentation in person, we play a little game, but I just wanted to share a few terms with you to see if you knew what they meant. And if you don't in any way teach anything about medical terminology or anything like that, you may not be familiar with these terms. However, most of our population is not going to be familiar with these terms. So the first one is esophagogastroduodenoscopy. If you know what that is, wonderful. Give yourself a point. If you don't, welcome to the other 99% of the population that likely is not familiar with that term. The next one is transient lingual papillitis, something that occurs very, very common, probably to all of us, but again, it's in its medical term, so you may not know exactly what that means. And the third one is blepharitis. Oh, somebody knows the first one. And people may have a better understanding of this one simply because it's the root word followed by itis. But if you know what those mean, wonderful. But again, if you don't, welcome to 99% of the rest of the population. So what do they mean? Well, it's funny that when I Googled gobbledygook, don't ask me why I did it, but a couple days ago, I Googled gobbledygook, and I actually found this book, Decoding Medical Gobbledygook. My grandmother would be so proud. I actually have been thumbing through it. It's a free download. It's on the issue website, but I promise you, if you too Google gobbledygook, you will see this book. And I thumbed through it. I didn't have time to read all of it, but I wanted to just offer it to you so that you could peruse through it and see if it actually helps health literacy for you. Could be a great teaching tool. But let's talk about what these terms are. So an esophagogastroduodenoscopy, commonly referred to as an EGD, is a very, very common procedure. And basically there's a scope that is introduced in the mouth, goes down through the esophagus, into the stomach, sometimes into the duodenum, we call the small bowel, and it's just used to view what's going on down there. It can diagnose various diseases or issues, and it's a very common procedure. But if you had never heard of it, imagine if your doctor tells you you have to have that, you might be thinking, okay, I'm very, very sick, right? And you may be, but again, think about the terms. So the lie bump, the transient lingual papillitis, or TLP, commonly called the lie bump. We've probably all had one of those. Sometimes they're small red, more often they're white bumps that you get on your tongue. Nothing major, but again, if you were told you had that, you might think that you need to get your affairs in order. So blepharitis, inflammation of the eyelid. Blepher means eyelid, itis means inflammation. So when you think about arthritis, gastritis, itis means inflammation. So one way that we learn these terms, whether you're a nursing student or a medical student or whatever, is audionyms. And they're still used to this day. And this is how I learned medical terminology. So whenever you picture something in your mind, it works. 30-something years later, these two pictures are in my mind. So for blepher, our eyelid, the audionym is blue fur. And you see a lady wearing blue fur with eyelids, and you get this picture in your head and you associate them together. Now, several decades ago, that's all I'm willing to admit to, when I was in nursing school, the audionym had a blue fur coat on the lady's eyelashes, and that the visual image was a blue fur coat on the eyelid, therefore blepher eyelid. And so if you look at the next one, you might be able to decipher it if you know what the organ is on the back of this truck. So it's a stomach, and the truck is a gas truck. And how they teach this is the gas truck, instead of hauling gas, is hauling a stomach. And it sounds crazy, but forever in your mind, once you learn this, you will know gastro, and you know it's stomach, and you see this semi pulling a stomach that was supposed to be pulling gas, and it really works. These are fabulous to use in graphic medicine, to teach in graphic medicine using audionyms, but in the form of the illustrations that you see in graphic novels and graphic medicine. I think would be a tremendous, I think it has tremendous learning potential for all different types of students. So now we're going to talk about what all of you really came for, and that is the actual novels themselves. So the very first one that we're going to talk about is about Betty's Boob. This is one of the first graphic medicine works that I can't even say read because it doesn't have words, but that I looked at. And we have it here in our library. And these are some of the first few pages that are in the book. So when you see the pictures, and I have chat pulled up, by the way, so I can see people's answers. When you look at these two pictures, does anything come to mind about what is being expressed in these pictures? Does it speak to any of you about what might be going on here with Betty? Breast cancer. And Carmen, why did you immediately think breast cancer? Did other people think breast cancer as well? That's exactly right. That is right. Crabs are cancer in astrology in the zodiac. That's right. So we're already talking about symbolism, and we haven't got any text on this page. So we see the crabs coming down. We have a man and a woman lying nude in their bed, peacefully sleeping, and the crabs are coming down. And on the next page, we see Betty's breast, and clearly the crabs are focusing on that. Now, if let's say we have other cultures that don't follow or learn about astrology, they may have no idea what this symbolism means and might literally wonder, why is somebody dumping crabs on this poor couple trying to sleep in their bed? You don't You know, we never know. So even this, everything has its limitations, but there might be some cultural barriers depending upon the culture of the person who created the book and those that are reading it. But the most important thing that I like to point out, especially to my librarians and instructors and even clinicians, is thinking about how this could be challenged as inappropriate material, not only in libraries, but classrooms, even clinics. And why might this be challenged as inappropriate? In the library, we deal with challenged and banned books all of the time. But if you look at this, you can think about reasons that people might still find this material inappropriate. Absolutely, the female form is still sexualized. We have nude bodies. We have a breast. These are things that can cause controversy and they can be challenged. This is by far the most powerful page in the book to me when I looked at this work. This page, it seems clear what's happening with Betty. In the first set, she's waking up, she's kind of groggy. You can see that she's lost her hair, probable chemo. It becomes clearer and clearer that she's in a hospital. She grabs for her wig, kind of sleepily puts it on her head. Things are crashing to the floor. She looks down and she has a red stitch area. That's very indicative of a wound, surgery. She has a flat area where a breast used to be. That is very indicative of a mastectomy. And when you look at the last picture there of her screaming out but not saying any words, it's very, very powerful what type of emotion and feelings that you can perceive that she's giving off. And I don't feel like we could capture that in prose as well as we capture it in a particular drawing such as this. Absolutely, grief, fear, pain, loss, confusion, anger, suffering, absolutely. And all of those words would be great words if this was in prose and we were actually reading it, but I would argue that it might not be as powerful. Fortunately for Betty, in the end, she has a lovely end to her story. She goes through a lot of turmoil. There's a lot of body shaming in this book, so much so by her own boss that she puts an apple in her bra because she could not afford the prosthetic or an implant. Her boyfriend, every time he sees the mastectomy area, he faints, and he's portrayed as like a pool of ooze. And she finally dumps the boyfriend and finds that her old life just does not fit her. And she happens to go into a burlesque show, and eventually she becomes a burlesque dancer. And some of the final pages that you see, I felt were extremely powerful because of the symbolism. So here we see Betty. She's in white. She looks like she's floating. We see a cage. The door is open. We see birds flying. And that really gives you the idea that Betty is free. She's adored in her new life because her old life no longer fit her. So this is a work of fiction, but after just looking at a few of the pages and discussing them, we have to ask ourselves, can works of fiction still teach health literacy? And I believe that it can. The next book that we're going to talk about is When David Lost His Voice. This does have both thought and spoken bubbles, and sometimes you're going to see a lot of medical jargon, but you can make your way through it even if you don't understand exactly what is being said. So we start out, and clearly David, he's the one with the white hair, he says, tumor. his friend and his doctor, whose name is George, has announced to him that he has a tumor. And you can see by David's different facial expressions, even though they're very, very slight, kind of what's going on as this page moves on. So George tells him that he has supraglottic cancer of the larynx. Maybe somebody would know what that meant. Probably not. David, after George tells him that, it seems that he's a little bit puzzled, or at least surprised. And then George goes on to tell him the type, which I believe would throw most of us, because David's mouth opens ever so slightly. And then George says, well, that means you can make it. And he says, you know, it's a stage 3, which if you don't know the stages, you're not sure if that's good, bad, or in the middle. It has spread. Note the word spread, because that in and of itself is going to cause major anxiety in most people. He says it's spread to more than one lymph node with no metastases. So if you're told that it's spread but no metastases, you might not understand all that that doctor is saying to you. And so you're going to pick up on key words: tumor, spread, you can make it, but can you? You don't really know. Well, as David progressively gets worse, he has to have a laryngectomy. He can no longer speak. He has a trach, which is a breathing apparatus on his throat. He has a young daughter, a very young daughter, and he has an older daughter. And he spends a lot of time with his younger daughter. And he writes her a note, and she goes and reads it. And what she does with it really spoke to me, because children deal with illness and death a lot better than we tend to give them credit for. And they also have some understanding of the process, even if we don't realize it. And so she goes and she reads it, and she puts it in a little bottle, and you can see the little bottle has the yellow glow. To me, that, you know, represents light, and she puts it close to her heart, around her neck. And so she's always keeping her father close to her. Unlike his older daughter, Miriam, who is just in a complete panic. But this page that I selected to show you shows you how she sees her father at this time. So you can see the skeleton, he's calling her name. Her face is one of, you know, shock. He says, "Are you listening, Miriam?" And as we go, you can see David's form continue to evolve from her seeing him as the skeleton, which in this case represents death, decaying, wasting away, illness. And then he finally says, "Miriam," and, you know, huh? And she jumps out of her trance. But this is how his older daughter views David at this point. So the two daughters' perceptions are very, very different. And as the work begins to end and David is fading away, the illustration here, you can kind of see that he has less form. His features aren't as, you know, sharp, and he's really just fading away. And that's how the illustrator portrayed that. And I thought that was quite strong. I'm not going to spoil the ending for you. The ending is an ethical argument that everybody has some sort of opinion on, but I will let you look at that for yourself. So now we're going to get into the non-fiction books. And this one is a brand new one that we just got into the library, and I read it and I absolutely had to include it. This is Kid Gloves, 9 Months of Careful Chaos by Lucy Knisley. And one of the things that she wrote about in the book is, you know, why should I write about parenthood? You know, what do I have to add to the conversation? And she began to think about how she knew lots of comic writers that were dads, but she really didn't know any comic writers that were moms. So she sought them out and began to read comics that were written by mothers. And that helped her to come to the conclusion to publish Kid Gloves. She has such a great humor, but at the same time, the way that she portrays it is very, very easy to read and understand, even by people that don't have a medical background. I say especially by people that don't have a medical background. This just stood out to me bigger than anything else, because here we have the human body with hair, by the way, and the baby inside, and all of these things, these symptoms that women can experience during pregnancy, and some, maybe all of them. But they're so distinct. Lungs are compressed, sense of smell stronger, pregnancy mask, relaxant causes the joints to loosen. And they're very easy to read and understand, and also identify with if you happen to be pregnant and having these experiences. This is a book that you can purchase and take home and read and laugh and cry and say, oh, she's gone through this too. I'm not alone. It could be in an obstetrical, it could be office, it could be in, so many different places, and really be a comfort to women that are experiencing this. She also talks about infertility. She had a miscarriage. Now she has a healthy baby, but she goes through a lot in this book. And I feel that it can really reach out to so many different types of women in their journey to have a child, and then also some of the problems that they can experience. She also does some very, very good research in her comic and presents it in such an easy way to understand. I point out for the doctor, why do my patients keep dying? As he's scratching his back and mothers are dying in childbirth. We didn't know a lot about aseptic technique and sterile technique. Now we know. Wash your hands. Mothers weren't given things for pain. When they first started coming around, mothers were put to sleep. My own mother doesn't even remember my birth because she was put to sleep for the most part. We know that didn't necessarily help mom, and sometimes we needed mom to help baby. So putting them to sleep was not the answer either. But she goes through the various history of natural childbirth and all of the different eras and what was going on at that time. And of course, the last one, we have mom on morphine, and everybody understands morphine is not going to be good for the baby. In her own personal journey, after she goes into labor, she begins to have some problems, and she's going to have to go for an emergency cesarean section. And what that means is she's going to go into an operating room. They're going to cut open her abdomen and remove the baby that way, because for whatever reason, she cannot deliver naturally. And I thought that the way that she drew this was so powerful, because she's sharing with you what she remembered just before completely going out for 2 days. And you can kind of see the black hole there, and that just really spoke to me. And then what she did feel as she was being put under, John's crying face, a small warm body held against my cheek, her baby. She knew that was her baby, but she's out for 2 days because she had some things that were going on. But this is just a really great book that I believe lots of women can identify with, and it's not very long. So I definitely am happy that I got to include that. The last and final book that I'm going to share with you is one of my favorites. One of the first graphic medicine books that I ordered here at the University of Southern Mississippi Libraries and read myself, and it is fabulous. So RX stands for prescription in the medical world, and Rachel Lindsay, this is her story, and this is how she remembers and experienced her journey with bipolar disorder. As we all have said before, things can be sometimes a vicious cycle. And here she shows the circle of you're diagnosed with a mental illness. You have to have insurance to cover the medication that you're given. You have to have employment to have the insurance, to take the drugs. And it just goes round and round and round. And where we stop, nobody knows. She also shows you how she perceived her bouts of mania, the ups and downs that is so prevalent with bipolar disorder. And you can see that in this one page, she comes home, she doesn't look very happy. You can see that it's more of a storm cloud instead of a thought bubble, but something's happening with her phone. She picks it up. She has a new work email. And what's important about Rachel's work is that she is diagnosed with bipolar disorder, and she is working for a pharmaceutical company, and her very position is working with bipolar medications. So she is going around peddling the medications in doctor's office and various places, talking to them about the different types of medications for bipolar disorder. She's also taking medications for bipolar disorder that she did not disclose, by the way. And it really gives her the type of perspective that most people wouldn't have. Because what are the chances that you're going to get diagnosed with bipolar while working for the pharmaceutical industry that and specifically working in their with their bipolar medications? So whenever she does discuss the different medications, I thought it was very poignant how she drew them. You will also see drawings that you probably have seen commercials. Latuda and Cymbalta right now, it seems like every morning when I watch the news, I see a Cymbalta commercial. So they're kind of hot on the market right now. They're not specifically just for bipolar disorder, but other mental health diagnoses as well. But the reason I thought that it was such a good idea to include this is because this is Rachel drawing her interpretation of these medications. So, you know, here with Effexor, we have faces that are literally, you know, just disappearing and peeling off. Zoloft, you're so down, and the bird. Paxil, you're in the house, you can't even get out, the bird's out there. There's just so many different things going on in how she's portraying these different medications. But remember, she's getting her paycheck for working for somebody that creates and then distributes these medications. She has different ups and downs, and she has to be hospitalized a few times. She is very fond of using curse words. And when I first began to read this, being a new librarian, I thought, I wonder if I'm going to get in trouble for ordering this book. But absolutely not, because this is her story, and this is how she describes her experience. Now, does it necessarily belong in a young adult section? You know, I will leave that to the different librarians in the public library. I would say no. But in any event, this is the type of book that could be challenged because of the different words in it and some of the things that she portrays. However, I think that it is a great vessel by which we could lure people that might not otherwise read about different mental health disorders, that could really connect with this type of book. So again, it's another work, nonfiction, that we could use to help others connect in some way. And also, even just nursing students and medical students, let's look at it from how Rachel sees it. You know, we've got angels and devils and crying and screaming and anger and happy and just so many things. And at the same time, she's trapped. She's trapped in in a bottle, a prison of medication. So there's so many things going on in this book, and definitely it is worth your time to read it for yourself. Now I want to move on to graphic medicine for kids. They are not forgotten. And there are so many different types of graphic medicine works that are specifically for young adults and children. This particular one that I'm sharing with you now is the MediKids. And the MediKids have lots and lots of different types of books for children, and their whole purpose is to teach the child about the body and the specific illness that that book is about, and kind of how to deal with it. Not only that, but it also creates a great way for parents and children to bond and discuss exactly what's going on with that child. And so at this time right now, you can go to jumohealth.com and you can download Understanding Infections with the MediKids for free. And what it will show is, even though it's not COVID exactly, because it's talking about how kids can help the spread of disease and how they can help prevent that with things like hand washing. It points out the proper way to wash your hands. It talks about the main ways that we can protect ourselves from germs, but it is in a children's format. And it's a great bonding tool. And I also think that, you know, if children are sick with various infections, when I worked on the pediatric floor, this would have been totally cool to go in and spend some time with my patient and read a little bit to them. And I just think that this would be a great avenue. And one of the reasons I think that is because as you can see, they cover so many topics. These are just three of a few. We've got autism, we've got playing sports with epilepsy, and we've even got the MediKids explaining the intensive care unit. And what's so cool about them is you have Axon, he's the expert on the brain and the nerves. You have Gastro, remember that truck? He's the expert on the digestive system. And you have various experts that really discuss various things, and that's what makes the MediKids a very, very neat series where we can reach children of different ages. Now we're going to talk a little bit about some of the Corona comics that are out. Right now, the UN is offering free download of these posters, and there's a lot of them, but I picked these two to share with you. Haikona Corona basically means no way, we're not having you here, Corona, and it rhymes and it sounds good. So you can download these, and I could easily see these in elementary school bathrooms, maybe your own child's bathroom, in classes. I could see education students using these to do some of their student teaching, certainly pediatrics and nursing, so many different areas could use these posters, and they're free and they cover so many different things. But right now it's specifically COVID-19. We also have a ton of COVID-19 comics that are coming out, and I dare say it won't be long before we have COVID-19 in graphic medicine works. It's coming, and maybe there might already be some out, but we do have a lot of comics, and we do have several page-length comics. This one I got from my favorite site, graphicmedicine.org. They have so many there, and they're organized into children's and just various different subjects. And I grabbed this one because I thought, oh my gosh, this is so relatable, right? And you can see that he has stocked up on paper goods. He's got himself or herself and the bird and the dog all in hazmat suits. We're all kind of feeling like that. We no longer have a pillow on our couch. We have rice, and our tables have become coffee and ramen. And the whole getup just is so relatable that there's something in this. If you were to talk about society right now, you could use this easily to have a discussion about that. So seeing what all we've seen, I say that graphic medicine does increase health literacy. But of course, I say to you, it may increase health literacy, but it's only going to do that if we begin to use it. We do know that pictures and text together increase understanding. We know that already. We know that pictures can cross language barriers. Not always, because then we have to look at cultural factors. We also have to look at the fact that graphic medicine can include more than just books. We can print out one-page comics, hundreds at a time, and teach huge amounts of people, making it very easily accessible. But like everything, there are some issues that we have to think about. There's not a lot of empirical data yet. The people that are on the ground floor, this is a fairly new genre, are working on that. And there are data sets and original research being done and being peer reviewed and coming out in the journals. It's slow, but it's getting there. We also still have a stigma that tends to be associated with comics, that they are for children. I won't get into the graphic novel versus comic versus narrative, but they're accepted when they're called one thing, but they're for kids when they're called another. So we've got some stigmas and some different titles that we're going to have to get through and work out in and of ourselves. Also, healthcare employees and the general population, we don't have a lot of buy-in yet. I honestly believe that's because they don't have a lot of knowledge about this. But I'm hoping through presentations like this with people like you that you buy in and you might begin looking at comics as a way that you can talk to your children or your class, right? Or anybody in your clinic if you are a healthcare worker, because it is important that we have buy-in or it's not going to work. So why should various libraries, classrooms, hospitals, clinics, and I could go on, add graphic medicine to their collection? Healthcare changes every day. What is today's latest and greatest medicine is tomorrow's lawsuit. However, the diseases in the disease process may not change that much. So when we have someone that writes about their experience taking care of a loved one with Alzheimer's, even though the medication and the treatments may get better, get worse, or change, it still is valid that that's what that particular family went through when their loved one had Alzheimer's. So it can really be informative to a healthcare journey, even if some of the medications may be out of date. It also helps really decrease feelings of isolation from not only perceived, but real stigmas that are associated with illness. I give you HIV/AIDS in the late 80s and early 90s. Huge stigma that was associated with that. People were afraid to go and ask for information in a library. These types of novels can really reach out and open up a dialogue that they may come back and get more. Also, it's very, very inexpensive. Again, I can print out 100 pages of a comic teaching about how to take care of basic first aid or wash your hands, or maybe I'm teaching a baby care class. I can print out how to properly change a diaper or umbilical cord care. And it's very, very cheap to do so. Unlike having to purchase various books or internet to get on Google and Google it. Not everybody has that, but it's very inexpensive to share a page of paper. If you're interested in learning more about graphic medicine, I not only encourage you, but I invite you to go to graphicmedicine.org. There you'll find a graphic medicine database that is updated over and over again with all of the newest graphic medicine that is published. You'll also find reviews on those. They have a podcast and a blog, and we even have a monthly get-together where those of us that can and cannot draw, you have a topic and everybody just kind of gets together virtually. There's a graphic medicine channel on YouTube with over 100 videos. If you go on YouTube and you just type in graphic medicine, you can locate that and you can subscribe. Start where I started, read the Graphic Medicine Manifesto. There's about 12 essays in there from the people that really got this going and started it. Absolutely. The National Library of Medicine has a wonderful graphic medicine site with free posters, resources, a traveling exhibit. You know, there are places that you can go and get a lot of free stuff. So that is basically it. If you want to find out more about graphic medicine, we have a really, really great Facebook group with people from all over the world. You can hashtag graphic medicine on Twitter. You can look for us on Instagram. Again, if you'd like to speak with me about any of the books, the topic, please feel free to email me at jamie.stanfield@usm.edu. And with that, I'm going to stop talking. I'm going to open up the floor for questions. If you want to speak, fine. If you want to put them in the chat, that's great too. But I'm going to just leave it to you all for the next 10 minutes.
Okay, Jamie, we do have one question from a person who posted. MediKids, are they all age grade levels or all grade levels? Or are they specific? Do
They do have different ones for different age levels. The most common age level that I've seen though is ages 7 to 12. Yes. We have a lot of those ordered for our library. Our human sciences and psychology education librarian really also liked what the MediKids had to offer. And so he ordered several for our library that I'm really excited to get in and start reading.
Are they reasonably priced, or are they,
yes.
Do you know?
Yes, they were very reasonably priced. If I remember correctly, they were $15 to $20 each brand new. And that was, you know, without a discount, et cetera, et cetera. You could go to Amazon and probably get them for less than $10.
Okay.
Any more questions? Absolutely, Monica, yes. There is a Spanish graphic medicine website, Medicina Gráfica. If you go to graphicmedicine.org, you will also see Medicina Gráfica. You will see a sister Japanese website. Please click on the link that is there or copy that if Spanish is your native language. You'll see a lot of manga on the Japanese website, but I love that you can find all of that right there, kind of bundled up for you on graphicmedicine.org.
Okay, any more questions, anyone? Well, I will take this moment to let everybody know that we are going to do this session again. We're going to use Twitch. We're still figuring it out ourselves, but we're going to use that platform in a couple of weeks. So look for the post on USA Libraries Art Galleries on Facebook, Instagram, and on Twitter. Just keep an eye out for that. If you haven't followed us already, please do. We are posting weekly now things. So especially art, if you're into art, we are going to begin our virtual art series. We will have a new artist every week and interview artists. For example, next week we have one of our Black Lives Matter local artists is going to be talking about her project and her arts. Fabulous stuff. Sorry, Jamie, I had to drop that in.
That's okay. Susan had a question. Is there a list of books on a resource somewhere? Absolutely. If you go to graphicmedicine.org, you'll notice as you scroll down, if you look on, I believe it's the right side of the page, there it says Graphic Medicine Database. And if you click on that, it's a huge Excel spreadsheet, and it gives you a little bit of information about the book, the author, and you can just continue to scroll down. And then also there are a ton of reviews. And if there's not a review and you have read that book or you're interested, you can contact the wonderful people at the organization, and they will either ask if you'd like to write a review or possibly direct you to reviews. They've got a really great core team. I wouldn't be giving this presentation right now had they not stepped up and really been excited about my own interest and pointed me to all the right places. So definitely visit graphicmedicine.org and Graphic Medicine on Facebook. Oh, Paula, there's a question for you.
I know, I saw that. Okay, the short, long story is that we do art exhibits at South at our libraries every 2 months, but COVID has shut us down. So we have decided to take it virtual, and we will have new art exhibits at the USA Libraries Art Galleries page. Starting next week, you can actually meet the artist. Sonia Edwards Bush is the artist that we will have next week, and we'll do a live Zoom talk with her, and also get to see her fabulous work. Once you see her pieces, you're just going to be astounded. So we have artists every week. So also, if you are an artist and you want to participate, we do have openings. Just send me an email at pweb@southalabama.edu, and I will get you the information.
Any more questions? Thank you all so much for coming. Again, we'll send out more invites for our next round. We've got some more, it's got graphic things coming, but this time we're going to be tackling war and classic reading. So yeah, stay tuned. Bye, everyone.
Bye. Thank y'all for joining us.
Thank you.